Welcome. Thank you for being here today. If you'd like, please go ahead and put your name, college information, how you're feeling today. Go ahead and add that to the chat. We appreciate you being here promptly at 10. We'll get started here in just a minute. Good morning, Nikki. Good to see some names that I recognize. Good morning, Elaine. Thank you for being here. All right, and I'm going to go ahead and turn it over to Mia.
Good morning, everyone. My name is Mia Keeley. I'm a Dean in Educational Services and Support here at the Chancellor's Office. Very happy that you're all with us this morning to kick off Mental Health Action Week. This is our second annual Mental Health Action Week. The Board of Governors established Mental Health Action Week in 2022, in part to strengthen trauma-informed care expertise across our system, to improve classroom climates and campus culture, to remove structural barriers for students, and to advocate for additional resources to meet the diverse mental health service needs of our California Community College students. As you know, direct funding for mental health is new to our system, and I would say long overdue. So very happy to have direct ongoing funding to help serve mental health in our system. Today's mental health webinar will be on using data and evidence to promote mental health in California community colleges. Next slide, please. Just some housekeeping for today. Live closed captioning is available, and we also will be taking questions. If you will select the Q&A tab to post your questions during the webinar, that would be great. There will also be time at the end of the webinar for a Q&A after the presentation. And you may also post your questions in the chat. We will be monitoring that. So today's webinar, Mental Health Action Week, just giving you the dates and times of the other mental health webinars going on this week, and just pointing out that the system webinar, the only one at a different time is Wednesdays from 9 to 10. That one is part of our system webinar, so the time is a little bit different. Okay, next slide. So today's webinar is on using data and evidence to promote mental health in California community colleges. It's going to be based on new survey data on mental health and related factors such as basic needs among our students. The data is from the Healthy Minds study. It's a national study of student mental health that included 14 California community colleges. The data elevates the need for additional mental health services, and the presenters will highlight a mental health support pilot at East Los Angeles College, and they will also highlight effective and equitable strategies to support student mental health. So our presenters today are Ashley Johnston, a research and data analyst in the Health Policy and Management Department at the Fielding School of Public Health at the University of California, Los Angeles. She coordinates the Healthy Mind study for Los Angeles, California community colleges, and is developing a repository of school-based interventions for reducing mental health stigma. Our second presenter is Daniel Eisenberg. He's a professor of health policy and management in the Fielding School of Public Health at the University of California, Los Angeles. His goal is to improve understanding of how to invest effectively in the mental health of young people. He is a principal investigator for the Healthy Minds Network, and he's also writing a book about investments in children's mental health. And with that, I will turn it over to today's speakers. Thank you.
Hi, good morning, everyone. Thank you for the introduction. My name is Ashley, and just to jump right in, I'll just get started talking about the Depression Grand Challenge. So the Depression Grand Challenge is something that was launched in 2015 with the goal to cut the global burden of depression by half by 2050. And it does this through three research objectives. You can see them all on the screen here. 3 research objectives and 2 service and dissemination objectives. So the research objectives are to identify genetic and environmental causes and trajectories of depression, elucidate mechanisms underlying depression, and develop new and better treatments. The service and dissemination objectives focus on making treatments more accessible and identifying and sharing best practices, which is where we fit. And STAND is one of those projects within the service and dissemination arm. So with that, we'll move on to the next slide. Okay, so this is an overview of STAND, System of Care, or Screening and Treatment for Anxiety and Depression. And it's funded by the Los Angeles County Department of Mental Health. It was originally piloted on the UCLA campus from the fall of 2017 to the winter of 2020. And then it was adapted and piloted at East Los Angeles College, or ELAC, for 2020 to 2022, and it's still ongoing there. And the Alacrity Center will be taking it over and building on the program to develop pathways for expansion across California community colleges. And then walking through the system. So this is a triaging system, and students start by completing a mental health screener for depression, anxiety, and suicidality. And students experiencing any of these symptoms are then triaged to one of 3 tiers you can see in the lower left. So tier 1 is for students experiencing limited to no symptoms, and they receive self-guided online CBT prevention wellness program. Students experiencing mild to moderate symptoms are triaged to tier 2, which offers online tailored CBT with support from coaches. And students experiencing severe symptoms are triaged to clinical care, which is tier 3. And I don't have a slide for this because it's very recent, but I did want to share some data coming from ELAC for the period of March 2021 to June 2022. And during that period, just under 1,200 students registered and created an account. 66% of those students initiated treatment in one of the 3 tiers. Treatment typically lasts about 29 weeks. And initial findings have shown that in tier 1, participants experienced significant decreases in depression and suicidal ideation, but not in anxiety. And in tier 2 and tier 3, participants or students experienced significant decreases across all 3. So severity of anxiety, depression, and suicidal ideation. And I just also wanted to share some data from the UCLA pilot. So again, this was piloted from fall 2017 to spring 2020. All UCLA students were made aware of the screener, and then interested students were able to participate. And the graph on the screen is showing the proportion of students that completed at least 4 sessions that had a 30% or higher improvement on their risk score. So again, looking at depression, anxiety, and suicide risk severity. And now, for those of you not aware of the Healthy Minds study, it began in 2007 at the University of Michigan, and Dr. Eisenberg is one of the principal investigators. It has been on over 700 campuses, and we've reached over 500,000 participants to date. And it expanded to community colleges in 2014, technical schools, and faculty and staff in 2020. Under the main topics assessed, these are areas that students are asked on all surveys, and we'll look at a lot of these measures today. So mental health measures such as depression, anxiety, eating disorders, suicidality, and self-injury, lifestyle and health behaviors, attitude and awareness, service utilization, and academic and social environment. On the lower part of the screen, these are what we refer to as elective modules, or sets of questions that schools can opt to include in their survey if they want a little more information about one of these topics. And then just how to participate, it's really simple to do. You can submit an interest form on the Healthy Minds Network website, which is included at the end of this presentation. Study coordinator reaches out. You complete a form about your school's characteristics. Some of you might be already familiar with this process. We go through a research agreement outlining what everyone's responsibility is. We're provided a random sample, and then the HMS team, or the Healthy Minds study team, coordinates all data, and then schools receive an initial report at the close, and then a more formal report once the data has been cleaned and weighted. And benefits of participation, I won't go through all of these, but the ones that we touch on today in particular are able to use this data to evaluate existing programs and assess the need for programs and services at your institution, as well as advocating for new and improved mental health services and programs. We're also going to talk about making the economic case for investment in mental health services and The data will also be presented in a way where you can compare California community colleges to other national community colleges, as well as their four-year university student counterparts. So a little bit more about the data that we're looking at today. So again, this data is from the 2021-2022 academic year. And we have 14 schools in California community colleges that participated, 37 schools at the national community college level, and then we have 77 schools for national four-year institutions. We do construct something called a non-response analysis. So this is a gender weight. So for example, if we see that more female identifying students are participating in a study than male identifying students, which is very common, we need to add a higher weight to male identifying students to be more representative of the gender distribution at the school. And we'll just get started with some of the measures. So we like to start with flourishing. This is a measure of positive mental health. And students are asked to indicate their level of agreement on a variety of questions. And some examples are listed on the screen. So for example, I lead a purposeful and meaningful life. My social relationships are supportive and rewarding. I am engaged and interested in my daily activities. So the scale runs from 8 to 56, and flourishing is indicated by a score of 48 or higher. So looking at the graph, we can see that pretty similar levels across institutions, and in general, about 30% of students are flourishing at the community college level, and this is a little bit higher, about 33% for students at four-year institutions. We also like to look at the data by groups. This helps us to see who might be struggling or what groups might be doing really well. So you'll see this format throughout the presentation as well. So here we look at the data through race, ethnicity, gender identity, and first generation status. And in most cases, students are flourishing close to the national average, with the exception of students identifying as gender diverse, which we can see they're flourishing, 10% are flourishing. So pretty low. We also ask students about depressive symptoms. So they're asked a series of questions from the patient health questionnaire, and their total score will correspond to none, mild, moderate, or severe symptoms of depression. And then examples are on the screen of what they're asked. So for example, over the past 2 weeks, how often have you been bothered by any of the following problems? Little interest or pleasure in doing things, feeling down, depressed, or hopeless, feeling tired, or having little energy. So the graph on the right depicts students reporting that they are experiencing severe symptoms of depression. So that's a score of 15 or higher on the PHQ-9. And what we see is that community college students are experiencing higher levels compared to four-year institutions. And while California community college students are actually experiencing lower levels than their national community college counterparts. Again, looking at this through a socio-demographic lens, we can see that gender diverse students and non-first generation students are experiencing higher levels of depressive symptoms. Here we're looking at the prevalence of severe anxiety symptoms. So this is defined by a score of 15 or higher on the generalized anxiety disorder scale. Examples of questions students are asked: over the last 2 weeks, how often have you been bothered by any of the following problems? Feeling nervous or anxious or on edge, not being able to stop or control worrying, trouble relaxing, being so restless that it's hard to sit still. So looking at the graph, we see that California community college students are experiencing lower levels of anxiety compared to their national community college student counterparts, and about the same level as students at four-year institutions. When we look at this across sociodemographics, we see that Black students and gender diverse students are experiencing higher levels of anxiety compared to the California community college average, which was about 17%. And in this case, we actually see that first generation students and non-first generation students are experiencing similar levels of anxiety, both of which are close to the average for California community colleges. So now we're looking at the prevalence of eating disorder symptoms, and we measure this using the SCOFF scale. The questions listed on the screen are examples of questions, or all of the questions students are asked. And from the graph on the right, we can observe that community college students are experiencing slightly higher levels of eating disorder symptoms compared to the national four-year students. Looking at this across from sociodemographics for California community college students, we can see that Asian students, Hispanic students, female or gender identifying students, and first generation students are reporting higher levels of eating disorders. So now we're looking at suicidality. So students are asked 3 questions here. The first one is ideation. So in the past year, did you ever seriously think about attempting suicide? Students are then asked in the past year, did you make a plan for attempting suicide? And then in the past year, did you attempt suicide? So we can see that California students report lower levels of suicidal ideation compared to students at other community colleges and four-year institutions, and similar levels compared to students at four-year institutions on planning and attempt. When we look at suicidality through ideation for California community colleges, we can see that students identifying as 2 or more race ethnicities, gender diverse, and non-first generation students are reporting higher levels of suicidal ideation compared to the average, which was around 14%. So now we'll shift to talking about medications and therapy or counseling usage and a little bit about help seeking. So the first question in this set is asking about students' perceived need. So here they're asked to indicate their level of agreement. You can see across the bottom of the graph. And they're asked, in the past 12 months, I needed help for emotional or mental health problems or challenges such as feeling sad, blue, anxious, or nervous. We can see that more than half of the students agree to some level. So some would agree to strongly agree, meaning they did need help in the past year, and it's similar trend across institutions. Looking at therapy use over the lifetime, all participants are asked, have you ever received therapy or counseling for mental health concerns? And the graph shows that California community college students report lower levels of using therapy compared to their community college counterparts and students at four-year institutions. And looking at therapy currently, so here we're looking at students that are currently receiving therapy. On the left, we show the distribution for all students asked this question. And then on the right, we see the percentages for students experiencing severe symptoms of anxiety or depression that are currently using therapy. So for example, that's a score of 15 or higher on the scale for depression or the scale for anxiety. Now, for this one, we're looking across sociodemographics for the population that identify as having severe symptoms of depression or anxiety. So here we can see that those identifying as white students, two or more race ethnicity students, gender diverse students, and non-first generation students are utilizing therapy at higher levels than their counterparts. And this is asking about medication use. So students are asked about medication use in the past 12 months. And right away, we can see that antidepressant medications make up the majority of medication usage in the past year across institutions. And also note that California community college students are reporting less medication usage compared to other community college students. And then this is a question that we're asking about informal help seeking. So we want to know in the past 12 months if students have received support for mental or emotional health from any of the following sources. We can see from the graph that friends who are not roommates, significant others, and family members are most often the sources of informal support for community college students. And if I draw your attention down to the none of these categories, we can see that California community colleges report none of these informal sources of support at a higher rate than other community colleges and students at four-year institutions. And the last one I'm going to look at here is on help-seeking barriers. So students are asked about which barriers or which factors have caused you to receive fewer services, such as counseling, therapy, or medications for your mental or emotional health than you would have otherwise received in the past year. And for California community college students, we see the biggest barrier to seeking help is financial reasons, which is about 32%, and not enough time, which is 26%. And with that, I'm going to pass it over to Dr. Eisenberg.
Great. Thank you, Ashley. I just want to add a few kind of points of context before go on to present a little bit more data. So the we've had now 13 or so community colleges in California collect data through our Healthy Mind study, in large part thanks to our collaborators at HSA CCC, the organization that many of you are probably familiar with, the Health Services Association for California Community Colleges. And as you may know, they have a research committee with Becky Pirelli and Sang-Lang True and Nicole Johnson, and they have really kind of motivated and organized this whole cohort of community colleges to collect data. And we're hopeful that many additional community colleges in California will want to collect this data as well. Hopefully you agree that it can be helpful. Also, kind of as context, like, well, what do we do with all this data? And we've been kind of focusing on some of the comparisons across like California versus national, or community college versus four-year, or across demographic groups or gender identity and other groups. I think those comparisons are definitely important to look at. At the same time, I think just want to remind everyone that probably the bottom line for these data for most of you is simply that the level of needs are very high among really all groups of students and all types of schools. So we're seeing very high prevalence of mental health risk and concerns. And while the rate of using services has been going up over time, particularly at community colleges, most or just a high fraction of students with high needs are generally not able to access supportive services at the level that we probably want. And so I think we're all kind of struggling together to figure out, well, how can we get more support and better support to students? And towards the end of this presentation, we'll say more about, well, kind of what are some of the ways forward. So next slide, please. I'm just going to go through a bit more data. I know this is really fast, kind of going through all this data. The slides we're happy to make available afterwards, and so you can kind of go through the details at your leisure. For now, we're just kind of illustrating some of the wealth of data that are available that highlight the great needs of students and some potential paths forward. So there are, of course, a variety of issues connected to mental health that are important to look at alongside mental health, and basic needs is one of them. And so food insecurity is one kind of indicator of basic needs not being met. And what we see here is that a large percentage of students, around 50%, if you add up the kind of the bars on the right side, around 50% of students are reporting some form of food insecurity. This is just for California community colleges, for just 3 of the schools that had this version of the survey with these items. Next slide, please. Financial stress, which is an indicator, a survey question that is there for all schools in the survey. What you can see here, first of all, is that a high percentage of students are reporting a lot of financial stress, that they're saying that their financial situation is either always stressful or often stressful. You can also see that community colleges in general see a bit more financial stress as compared to four-year populations. Next slide, please. Looking across racial ethnic groups, here really all groups are reporting financial stress in high numbers. You can see that Black students are the highest among these groups. The highest percentage saying that it's always stressful. Next slide, please. First generation students among California community colleges are, as you might expect, a bit more likely to report financial stress compared to non-first generation students. Next slide, please. Sense of belonging, as you probably have thought about as well, is an important indicator of kind of student experience and is connected to mental health. I think we'll show a little bit in this, but basically, as you might expect, sense of belonging is highly correlated with mental health, and also with kind of indicators of academic success. So interestingly here, we see that sense of belonging looks roughly the same when you compare California community colleges to national community colleges to national four-year schools. You can also see that there's quite a distribution. So you've got a fair number of students who strongly agree that they see themselves as part of the campus community. You also have a fair percentage of students saying that they strongly disagree or that they disagree, and then a lot of students in the middle. So students are kind of all over the place on this indicator. Next slide, please. Among California community colleges, interestingly, perhaps, first-gen students are about the same in terms of the distribution of sense of belonging compared to non-first generation students. And we don't have this data in the presentation, but just as an aside, when we look at four-year schools, we actually see a clear difference where first generation students are less likely to report sense of belonging compared to non-first generation students. So maybe that indicates, I think, an asset of community colleges is that there's kind of greater equity in terms of sense of belonging for first generation students. Next slide, please. So I'll just show a few measures related to academic impairment and persistence. Next slide. So first, we asked the students in the past 4 weeks, how many days have you felt that emotional or mental difficulties have hurt your academic performance? And what you can see here is, so less than 20% of students are saying no days. In other words, more than 80% of students are saying that at least on one or more days, they felt like their mental health was affecting their academic performance. And almost 30% of students, you can see on the right side, are saying 6 or more days out of the past 4 weeks. Next slide, please. Here, this is a lot going on this slide, so I'll just say the bottom line here is that, as you might expect, students that report higher sense of belonging with their campus community are reporting lower levels of academic impairment related to mental health. Next slide, please. Here we see that first generation students among California community colleges a little bit, I guess, say more likely to report some academic impairment related to mental health, but not big differences here. Next slide, please. Here, we can see clearly, we completely expect students with severe symptoms in terms of depression or anxiety are quite a bit more likely to report academic impairment related to mental health. Next slide. We also asked students, how much do you agree with this statement? I am confident that I will be able to finish my degree no matter what challenges I may face. And here we see that most students are actually optimistic. They agree or strongly disagree with this statement. And it's actually not that different for community colleges versus four-year schools. Next slide, please. And actually, first-generation students in California community colleges have similar level of optimism in terms of persistence as non-first-generation students. Next slide. Here, the bottom line, I got a lot going on in this one as well, but the bottom line here is that students who report greater sense of belonging with their campus community are quite a bit more likely to feel optimistic that they will complete their degree. This is something that's been talked about in higher education for decades. So we're not sharing something new here, but we're documenting it with some data in California community colleges. Next slide. And as I just mentioned, there's been a lot of literature over the decades really about sense of belonging, its importance for retention and persistence, academic experience, but I think I think there's a kind of a newer focus now on how belonging relates to mental health. And I think that's, as some of you have been thinking about, I'm sure, kind of a pathway towards maybe some more effective support, or creating a more supportive environments in terms of student mental health is by fostering sense of belonging. Next slide, please. So students who are experiencing severe symptoms are, as you would expect, less optimistic about their persistence in college. So we're starting to see there's a connection between mental health and academic success and persistence, and I'll expand on that in a minute. Next slide, please. So what we've done in some previous research with Healthy Mind Survey data is to look at how student mental health actually predicts whether students remain in college and complete their degree, or whether they leave college without completing their degree. This is, and I have to acknowledge here that this research has been done in four-year institutions, although I would expect the results to hold up similarly in community colleges. Next slide. So we've found roughly that students experiencing higher levels of depressive symptoms are about 2 times as likely to leave college without graduating compared to students with lower levels of depressive symptoms. And we've translated that to an economic case for investing in student mental health support and services. So if you, and I don't want to go through, I can't go through the details now, but roughly if you think about a hypothetical investment, whether it's a treatment or prevention, as long as it's effective in reducing depression for say 1,000 students in your population, then on average we've estimated that could lead to retaining 56 students in college who would have otherwise left without graduating by reducing their depressive symptoms. And retaining that number of students, and this of course depends very much on the context, like what's your revenue model, when a student stays, how much revenue does that retain for your school. For four-year schools, of course, a lot of it has to do with tuition. For a community college, it might have be more tied to government funding and the formulas related to enrollment. But in some contexts, that 56 students might translate to increased revenue of around $1 million. And maybe more importantly, by allowing students to remain in college and gain higher level of education, their expected earnings over their lifetime dramatically increase. There's lots of economic evidence that each additional year of college leads to hundreds of thousands of dollars in expected earnings over a lifetime. So there's kind of an economic case for a whole society or entire communities to invest in student mental health and help them stay in college and gain higher levels of higher education. Next slide, please. So now I'm just going to shift to a handful of recommendations that our research group has been thinking about on kind of a broader scale. How can we use data and evidence to better support student mental health? Next slide. And so I'll go through each of these 5 recommendations. They're just summarized here on this slide, but I'm going to show them again in the next slide. So we'll just go right on to the next slide. So the first recommendation is, as you know, we've been showing a lot of population level data with our Healthy Mind Survey, and there are other sources of population data besides Healthy Mind Study, which probably many of your schools and networks have participated in, like the Real College Survey run by the Hope Center. But whatever source you're using, one of our first recommendations to campus leaders is to use data to regularly assess population level needs, priorities, and progress. And I won't go through all the details here, but I think one key point to keep in mind is that I wouldn't necessarily, if you're trying to think about progress and like, is what we're doing working, I wouldn't necessarily focus on measures like the prevalence of depressive symptoms in your population, because that's an important indicator of need for sure. But I think it's an indicator that's really hard to change at the population level, because students, so much of the kind of the mental health profile of your students reflects what they bring to their campus when they arrive on campus, or they arrive in your campus, your college community, and their family background, their other kind of challenges and strengths that they have in their lives. And I think we should be probably a bit humble about the fact that we can't necessarily, for a lot of students, change their mental health dramatically. What we can do, I think, is we can change the level of support and the supportiveness of their environment. And so I think those kind of more proximate, like kind of more immediate indicators of success would be like sense of belonging. We have questions in the survey about whether you feel like the campus community or college community is supportive for mental health, whether you feel like the academic environment is supportive, whether students know where to turn for help, whether they know about the services and resources that are available, whether they have access to services. Those, I think, are indicators that could be changed more realistically in the short term. Next slide, please. So we've also, our team has been doing kind of a comprehensive look at the evidence base about what supports student mental health, what evidence do we have? And we've been really looking kind of more at the public health level or community level for strategies. So what I mean by that is not necessarily clinical services. Clinical services, I think, have a much larger and richer data kind of evidence base that's already in place in professional associations like psychiatrists and social workers and psychologists have kind of summarized best practices. So we don't necessarily have something new to say about clinical practice, but what we're kind of looking more at is like kind of at a more population level or community level, what is the evidence for those types of programs? And one thing that we've seen is that there are a small number of types of programs that do have quite strong evidence to support student mental health and higher education, particularly skills training interventions, preventive interventions that really focus on skills training, mindfulness, for example, CBT, cognitive behavior interventions, those that really focus on specific skills and have some kind of practice or supervision that helps students kind of ingrain those skills. Those generally seem to be effective. Also, screening for depression, for example, and suicide risk, those programs, of course, when there are supportive services that can be referred to, those are generally have good evidence in higher education and other settings. And means restrictions as well for reducing suicide risk generally has strong evidence. So these types of strategies that already have strong evidence, our recommendation number 2 is in higher education, we should be investing substantially in things that we basically know work. Next slide. There's also, I think we also should be candid with with ourselves that the evidence base is not complete, and there are some weaknesses in the evidence base, and there are some types of interventions which, based on our review, actually don't have very strong evidence. And one category of that is what we're calling psychoeducational interventions. And what we're saying here, we're not saying that that's not helpful. Psychoeducation is providing kind of knowledge about related to mental health, but generally speaking, the evaluations of that kind of approach by itself as a standalone program are not showing great outcomes. Psychoeducation in combination with, say, like skills training or other kind of more behavioral or kind of more concrete approaches do often have good outcomes. So that's just a caveat to keep in mind. Gatekeeper training is a program, as many of you know, that an approach that provides training to non-mental health professionals to better identify students at risk and refer to appropriate services. Here, what we're saying based on our review is that the evidence is actually not, I'd say, not as good as we hope. There's pretty good evidence that a lot of gatekeeper training programs make the trainees more confident and feel more knowledgeable, but actually translating into community level changes in actual referrals to services, kind of the more concrete behavioral outcomes. I think that's where the evidence is a little bit lacking so far. And so we're not suggesting to abandon gatekeeper training programs, but we do think that we need to continue to think about how can we make them stronger. One idea that we and others I think have been pushing for is that a lot of these trainings tend to be one-time trainings. They just happen maybe for one day and that's it. And it's probably not realistic to expect that to have a really strong lasting impact on a community. Instead, we probably need to have booster trainings or some kind of way of reinforcing the initial training so that it's more salient and kind of the trainees continue to build on their skills. Next slide, please. Our next recommendation is that to invest maybe more modestly, but still invest in strategies that have promising evidence and then evaluate and reassess. So there's a whole lot of intervention strategies kind of at the campus level or community level that have promising evidence, but not definitive evidence. And we just listed a variety of these like sense of belonging type of interventions, peer support programs. A lot of them have promising evidence, but just haven't kind of taken the next step to really like maybe a randomized trial or like a really strong quasi-experimental evaluation. Other intervention approaches haven't really even been evaluated that much for student mental health outcomes, like family-based interventions. So just to summarize, there's a lot of exciting opportunities, but we do need to collect data and kind of do rigorous evaluations to really understand which of these are working, which ones are not, and not just assume that they all are working. Next slide, please. And then I guess kind of more at the network levels, maybe the state level, we would encourage that there's kind of more support for campuses to make decisions to help kind of make sense of all this evidence, like what's available, what works. It's really hard, I'm sure, as all of you know, to figure out which programs to use and even how to implement them effectively. And I think at a kind of a system level, there's opportunities to give incentives, encouragement, support. We're hoping that kind of as our team, we can kind of contribute to a centralized database of evidence that you can easily turn to and kind of help make sense of the evidence. So we kind of need this infrastructure for campuses realistically to take a more data and evidence informed approach to student mental health. Next slide, please. So here's just a few links if you want to read more about some of our work. But now I think we have 15 or so minutes for discussion, Q&A.
Thank you so much, Dr. Eisenberg and Ashley. A first question that's come through is, how can a California Community College participate in future studies? Who do they need to contact, or how can they get involved?
Yeah, well, so if by future studies, the question is asking about the survey, the Healthy Mind survey, and all the data that we just showed, then you could email me or Ashley. You could also contact our friends at HSA CCC, like Becky Pirelli. Ashley also mentioned if you go to the Healthy Minds Network website, you'll see there's a page where you can read more about the survey and fill out a form to express interest. But does the next slide have our contact information, Ashley? Oh, or that slide. Okay, yeah. So yeah, you can just email us. That's probably easiest, but there's other ways I mentioned.
Thank you so much for that. And another question was, do you have any sample questions you can share to help them collect the data that they're going to need?
So we do have our full, if the question is about like, what does the survey actually look like? We have the full survey questionnaire on our healthymindsnetwork.org website. So the website can be a little hard to navigate. It's not always intuitive. So, but if you go, there's a couple of different places on the website you can go to find the actual Healthy Minds questionnaire survey, if you go to like the data tab, I think also if you look at this survey tab, I don't know if Ashley, you have any, if you have trouble, you can always email us too. But the full questionnaire, and it's gonna, when you click on it, it's gonna be scary because it's like 100 pages. But don't worry, it's one thing we didn't mention, I think, is that it's a modular format. So there's a few sections of survey that are core modules that are always in the survey. And then after that, there's kind of this whole menu of elected modules, like topic, and each school chooses like from that menu, which sections do you want to include in the survey? So the whole survey ends up being 20 to 30 minutes for the student. It's that they don't go through the whole 100 pages, which would take hours and hours.
And another question coming through, will you be presenting at the ACHA conference in Boston later this month?
I don't think our team will be there. I know Ashley and I will not be there. Sometimes we have presented there, but unfortunately, I don't think we'll be there this time. But we do like enjoy going to conferences like that. And I recommend that conference is a good place just to learn about data and programs for student health.
Definitely. Are there any studies on the effectiveness of syllabi statements conveying importance of self-care and seeking services?
It is something that we mention in the syllabi statements. For those who don't know, like in recent years, there's been kind of a trend towards encouraging instructors, or maybe even some schools even require instructors to include a paragraph or two about the importance of mental health and self-care and links to resources at the college or university. I think we mentioned that in our review of evidence as an example of a promising practice that doesn't. I think there's a bit of evidence that suggests that it's helpful. There's a lot of anecdotal evidence. I think I've heard a lot of kind of nationally, a lot of just enthusiasm for the idea. It's so easy to implement, and seems like it's powerful. I think generally, so that's just to say, I think there's a bit of evidence, but maybe not as much as ideally we'd like to have to say for sure that it works. But generally, I think one thing that we've been thinking about over the years is that to the extent that we can integrate mental health support and mental health messaging into the academic lives of students, then that seems like a really powerful channel to because academics that's kind of the core for most students. That's where they are. They go to class, they attend class, they go to the course websites, they look at the syllabi. It's just part of their daily lives. We're not asking them to do anything extra when we therefore kind of try to provide support related to mental health in those contexts. And also it kind of helps, I think, make more visible that important tie between mental health and self-care and academic success.
Thank you. Could you provide a little bit more detail on the weighted sampling involved in the data analysis?
Yeah, I don't know. I don't want to Ashley, do you want to comment a little there, and I can add it if you want, but I don't want to hog all the answers here.
Sure. So typically we find that female identifying students respond more in survey research than male identifying students. So to ensure that the sample is more representative of the school, we try to weight it so that it's similar to the gender distribution of the school. So one of the questions schools are asked to submit when they're getting enrolled in the survey is what their gender distribution is. And then we can add a higher weight to male identifying students to be able to bring that up closer to what the gender distribution is for the school.
Thank you for that. And the next question is, in the study, the question asked about the sense of belonging. Did it differentiate or distinguish between campuses with dormitories or those that did not have them? And also, second part to this question, can you provide an ideas on examples of learning environment interventions?
I think I can comment on the first part. We do have a question that asks about the residents or where they're living, but it wasn't included in the presentation. So if you had your own data set, you could look at sense of belonging crossed with where students are residing.
But yeah, we haven't broken that down recently. I think that's a good follow-up analysis. I'm pretty sure if we did look at students living on campus, we would see higher sense of belonging. It's just very intuitive. Partly because students who choose to live on campus probably are more interested in having a sense of belonging. They're actually choosing that want to be part of the campus community, where a lot of other students maybe choose, like, maybe college is just kind of one modest part of a much more complicated life that they lead, and so they aren't necessarily looking for that same level of sense of belonging. But yeah, we can look more at that.
Perfect. And we'll save all of these questions so we can forward them on to you. Another question that came through: has there been any data related to a campus having an Active Minds chapter and how that impacts students' mental health?
Yeah. Well, now these days, fortunately, Active Minds is everywhere. I mean, not every single college university has Active Minds, but so many do that it'd actually be hard to do a comparison because there aren't that many schools that don't have one. But I think some of you probably aware there was a nice evaluation study in the state of California, happened maybe 5 years ago or so, where it looked at students who participated in Active Minds, and it looked at kind of how some of the outcomes that they experienced, and it found generally, I think, if I remember correctly, that kind of positive outcomes related to well, let's see, related to stigma. I think there were students who participated in Active Minds had kind of more positive attitudes related to mental health. If there was more to it than that, but I'll look it up and I can include it as a follow-up material, because it was a nice evaluation. It basically showed like a variety of positive benefits associated with the Active Minds organization and participation in that organization.
Thank you so much. Next question is: sense of belonging seems linked to mental health and academics. What are some interventions that promote the sense of belonging that have shown strong evidence with mental health and academics?
Was that something that you reviewed, Ashley, recently?
A little bit.
Yeah.
So most of sense of belonging we're seeing with academic outcomes, and there's not a lot with outcomes looking at mental health. So we're thinking about it more from, we're seeing all of these associations between mental health and sense of belonging, but we're not seeing this translate into intervention. So it's somewhere we'd like to see a little bit more research. I believe there was a major study done a while ago, and sense of belonging improved academic outcomes and mental health, I believe, for, I think it was lower socioeconomic students. I can't remember. And then mentoring as foster sense of belonging as well is shown to have a lot of academic outcomes, but we're not seeing a lot of it together. It's something that would be nice to see.
There's a couple of interesting studies. And again, I'll have to look up the details because I don't remember them all top of my head, but it's a brief intervention. I think it was done in Texas initially, where they had students write kind of a note, maybe to future cohorts, about kind of the challenges that they were facing. I think maybe as first generation students or lower income students, the worries that they had about succeeding in college and the kind of how they were able to succeed. And I think I might not be getting it quite right, but it's kind of a journaling exercise. It didn't take a lot of time, and they actually found some surprisingly powerful benefits in terms of, I think, maybe student persistence, and I think mental health as well. So that, and it also showed, I think it was framed as kind of a belonging intervention, because the idea was like, these are students who were worried about whether they really belonged. And they're kind of writing about those worries and kind of overcoming those, I think, was therapeutic in a way and led to better outcomes. But I'll find the references. It's part of our larger review. Also, we have maybe another follow-up material we can provide is we have this very long review of the evidence that we compiled in a chapter for the Handbook of Higher Education.
Thank you so much. So there's a couple of questions left. I am going to go to the chat for the last questions. If you've submitted a question and it's not being currently answered live, we will get together with Dr. Eisenberg and Ashley to get a Q&A document out to everyone, so we can make sure that we touch on all the answers to all the questions. A question from Jeanette in the chat says, do we know what might be the cause of higher levels of issues with 2+ race students versus others? The second question, referencing the sense of belonging slides, do you know the general reason how students define their sense of belonging? And gosh, that's a long one. Third one, what contributes to the outcome or differences between California students versus the national average?
Those good questions. So the first one about multiple race categories and higher risk for that group in some measures. I suspect there's additional literature on that, so I don't want to speculate too much. It's not really something that we've explored. A lot of what we've done is kind of superficial analysis. I don't mean that in a bad way. It's just that we're covering so much ground with our survey that we're kind of highlighting some interesting findings, but we don't have the kind of additional measures to really go beyond that. Although there is actually, just to address one of the other questions in the Q&A, like, can you do additional analyses with our data? Yes, we make our data, our de-identified data, available to any researcher or practitioner who wants to analyze it for themselves. And so there's probably more that we could look at with an example of that question, where you could look at, well, what combination of racial ethnic categories are actually higher risk. That kind of breakdown might be illuminating, but we don't have the answer right now for that. Sorry, the other.
The second question was referencing the sense of belonging slides. Do you know the general reason how students define that sense of belonging? What was the question involved around that?
Yeah, I mean, the survey question that we focused on was just simply, how much do you agree with the statement, I see myself as part of the campus community? And of course, that's not a full, there's other ways to measure belonging. We do, I think, have a couple other survey items in some versions of the survey that get at it a slightly different angle. We actually, just on that topic, want to mention we have one of the modules we didn't really talk about today is what we call our what is it, diversity and inclusion module, where we ask a lot about students' identities, the various identities that they have, and also kind of how that relates to their experience in campus, like whether they participate in various groups related to their identity on campus, and also whether kind of how they perceive the campus climate with respect to their own identity and other identities that students have, discrimination that they might feel like they're experiencing. So that's kind of connected to this question of like that those are different dimensions of belonging that we do get at with the survey in other ways. I don't know if, Ashley, from your review of belonging, if there's anything more you want to say about this, kind of how students think about belonging.
No, just whether they feel supported by their campus community. Do they feel connected to it? Those kinds of questions.
Mm-hmm.